HIV AIDS Epidemic by Samantha Flame. What is HIV and how does it spread? Human immunodeficiency virus, known as HIV, is a type of lentivirus, which means it attacks the immune system. HIV is found in blood, semen, preseminal fluid, vaginal fluid, rectal fluid, and breast milk. You can spread HIV from person to person when one of these fluids enters the body of another. These fluids must come in contact with a mucous membrane or damaged tissue, or be directly injected into the bloodstream for transmission to occur. Mucous membranes are found inside the rectum, vagina, penis, and mouth. What is AIDS? Acquired immune deficiency syndrome, also called advanced HIV infection or late-stage HIV. AIDS describes a set of symptoms and illnesses that happen at the final stage of HIV infection, if left untreated. Over time, fewer people develop AIDS because of the treatment for HIV. Where and how HIV began. It is widely believed that HIV originated in Kinshasa in the Dominican Republic of Congo around the 1920s by chimpanzees. Chimpanzees had a version of the immunodeficiency virus called simian immunodeficiency virus. It is believed to be transmitted to humans and mutated into HIV when humans hunted these chimpanzees for meat and came into contact with their infected blood. This theory still stands true today. While sporadic cases were documented prior to 1970, available data suggests that the current epidemic started in the United States mid to late 1970s. There are 3 stages of HIV. Stage 1 is acute HIV infection. Within 2 to 4 weeks after infection with HIV, people may experience a flu-like illness. When people have stage 1, they have a large amount of virus in their blood and are very contagious. People with acute HIV infection are often unaware that they are infected because they may not feel sick right away or at all. In order to know if you're infected, you must get tested either by using an antigen antibody test or a nucleic acid test. Stage 2, clinical latency, also known as HIV inactivity or dormancy. This period is sometimes called asymptomatic HIV infection or chronic HIV infection. During this phase, HIV is still active but reproduces at very low levels. For people who aren't taking medicine to treat HIV, this period can last a decade or longer. If taking medicine, a person can be at this stage for multiple decades. People can still transmit HIV during this phase, however, people who take HIV medicine as prescribed have effectively no risk of transmitting HIV to their HIV-negative sexual partners. At the end of this phase, a person's viral load starts to go up and the CD4 cell count begins to go down. A person may begin to have symptoms as the virus level increases in the body, and the person moves to stage 3, which is AIDS. AIDS is the most severe phase of HIV infection. During this phase, the immune system is damaged so badly that people get an increasing number of severe illnesses called opportunistic illnesses. Common symptoms of AIDS include chills, fever, sweat, swollen lymph glands, weakness, and weight loss. People are diagnosed with AIDS when their CD4 cell count drops below 200, or if they develop certain opportunistic illnesses. People with AIDS can have a high viral load and be very infectious. Without treatment, people with AIDS typically survive about 3 years. The first treatment was introduced in 1987, scientists also developed treatment to reduce mother-to-child transmission during this time. In 1997, highly active antiretroviral therapy became the new treatment standard. It caused a 47% decline in death rates. The FDA approved Combivir in 1997. Combivir combines 2 drugs into a single medication, making HIV medication easier to take. Researchers continue to create new formulations and combinations to improve treatment outcome. Modern treatment, the combination of drugs that the treatment HIV and AIDS is called antiretroviral therapy, also known as ART. Taking this medication will slow the progression of the virus in the body. These treatments are very effective and safe. As a result, most people with HIV are living long and healthy lives. Treatment is recommended for everyone with HIV infection and should be started as early as possible. Medicines slow the growth of the virus or stop it from making copies of itself. Although these drugs don't eliminate the virus from the body, they keep the amount of virus in the blood low. This protects the health of the person with HIV and can prevent HIV from passing to sex partners. The amount of virus in the blood is called the viral load, and it can be measured by a test. With treatment, this viral load can be low enough that it does not pass from person to person. Societal views, stigma, and discrimination. HIV stigma is negative attitudes and beliefs about people living with HIV, labeling an individual as part of a group that is believed to be socially unacceptable. HIV discrimination is the act of treating people living with HIV differently than those without. Examples of this are believing that only certain groups of people can get HIV, making moral judgments about people who take steps to prevent HIV transmission, refusing casual contact with someone living with HIV, socially isolating a member of the community because they are HIV positive, people not wanting to get tested so they aren't discriminated against due to their outcome. Societal views over time. Many of our ideas about HIV came from the early 1980s. There are still misconceptions about how HIV is transmitted and what it means to live with HIV today. The lack of information and awareness combined with outdated beliefs that lead people to fear getting HIV. Additionally, many people think of HIV as a disease that only certain groups get. This leads to negative value judgments about people who are living with HIV. When the first few cases of AIDS emerged, people believed the disease was only contracted by men who had sex with men. Actor Rock Hudson was the first major public figure to acknowledge that he had AIDS. He did die of AIDS, but he left $250,000 to set up an AIDS foundation. In 1987, the United States placed a travel ban on visitors and immigrants with HIV, but this was lifted in 2010. The government has and continues to fund HIV/AIDS related services. Over the years, people become more comfortable revealing they are HIV positive because of the acceptance and change of the views. In conclusion, HIV and AIDS is still something we deal with today. Because the symptoms are flu-like in stage 1, a lot of people don't get tested or know they have it. This results in the continuous spread of the disease. We do have treatment for the disease, but there are no vaccines or cures. AIDS is far less common in modern day due to treatments and knowledge. Societal views have gradually become more accepting of this disease, but there are still negative stigmas. Citation.